Despite not having good healthcare in my hometown and the fact that it absolutely sucks for me, I forget how lucky I am that I have access to healthcare outside of my state that's really good healthcare. Getting into the Mayo Clinic these days is pretty much next to impossible. The fact that I can go to the Cleveland Clinic for services as well. I realize how fortunate I am. There are so many people out there who struggle with chronic illnesses who don't have access to adequate health care. I have a few friends with chronic illnesses who do not have access to adequate health care and don't feel comfortable with the health care that they're receiving because they know that they're not getting the treatment that they need. And while when I'm at home, I don't get the treatment that I need, and sometimes medical errors are made, and I feel really anxious and nervous about going to my local hospital, I at least have my PCP who will always argue for me, who is in my hometown. And I forget that I'm fortunate enough to be able to have that access to quality healthcare outside of my state. And I'm also fortunate enough that I have support to be able to go to those out of state healthcare providers. The fact that my husband works for himself and can at the drop of a hat take me to Cleveland Clinic and take me to the Mayo Clinic. I feel very fortunate and blessed that I'm able to do that. And I forget how many people don't get to go to the bigger healthcare providers to get quality healthcare so they can get properly diagnosed and get proper treatment. And I also have access to Nebraska Medicine, which is also a really good program. And I've had people message me asking how do you get into those places? And to be honest, it's just kind of been a miracle that it's happened for me. When I was first sick, no one locally could diagnose me, would even listen to me, would even run testing, would do anything. Finally, we got a local GI to run testing, basically to appease me. And he was shocked by, what came back from all of the testing. And then he dropped me because my case was too complex. But I forget how fortunate I am to have access to healthcare outside of my state that is, top tier healthcare. So, if you're struggling with a chronic illness and struggling to get quality healthcare, I really feel for you because I've been there and I've struggled with that, and I don't get quality healthcare when I am home, but I do have access to healthcare outside of my state that is able to help me get some of the treatment that I do need. So, I really do understand what it's like to not have that access to healthcare that you need to be able to get properly diagnosed.